Welcome back. You have spoken. The people have spoken. People's choice for best dermatologist in Central Florida goes to our good friends at Advanced Dermatology and Cosmetic Surgery. Pleased to be welcomed right now by two of their great physicians there, Dr. Morehead, Dr. Savina Aneja. Ladies, how are you?
Great, thanks for having us.
I feel a little intimidated, honestly. I went to law school and all, yeah, but two doctors next to me. I feel like I have so much to ask you. Should I be intimidated or no?
Absolutely not.
No, really? Are you intimidated?
A little bit.
A little bit too. So let me start with this. Florida, we have a lot of sun. It's hot here. People are outside here. You hear about, oh, if you're 25, you should go to the dermatologist. There's 35, but they're talking about people from Michigan, people versus Florida. It's a little different for us here, would you say?
Sure, for sure. In Florida, we do a lot of activities. We're exposed to a lot more sun. So from a young age, people are in the sun doing water sports, doing outdoor activities all throughout the year. And so we do want all of our adult patients to come in for total body skin checks, but we do want younger patients who are higher risk to come in as well. So if you have a family history of melanoma, a personal history of skin cancer, if you've had any kind of tanning bed use, blistering sunburns in childhood, we definitely want to see you in sooner so we can take a look at your skin closely.
Weird question, I know, but a lot of people have a primary care physician. Not everyone has a dermatologist that they know to go to. Do I go straight to you? Do I call your number? Do I go to your website, or do I go through my PCP? What do you think?
Well, it depends.
Yeah.
Some patients come directly to the dermatologist. Some people need a referral from their primary doctor, in which case you may stop there first.
Got it.
But what's interesting is one of the physicians in our group, Dr. Cotter, he recently published a study that shows that dermatology skin checks are actually 23 times more sensitive at picking up skin cancer as opposed to like pap smears for cervical cancer. So we know that skin cancer screenings are really effective at catching skin cancer, and there's a lot of value in catching a skin cancer early, because when we catch a skin cancer, when it's a stage 0 or a stage 1, we have a lot more therapeutic options, and we have a lot less downtime in terms of recovery. So we definitely want to catch skin cancers early.
I mean, skin's pretty important, and it's exposed all the time to this sun. Is there an age where I need to really do some progressive action against this, or do I just wait till something happens? When do I call you, Dr. Morehead?
Well, I think that you're never too young to start doing something, wearing sunscreen, wearing protective clothing. But again, like Dr. Aneja said, it really depends on your history. We recommend all adults come in for an annual total body skin cancer exam. And you know, like she said, the earlier we catch it, the better.
You know, and this is totally true. I've heard so many people come up to me and say that you guys are the best. Advanced is the best. Why is everyone telling me that?
Well, we are a large group, and because of that, we can all follow our passion. I'm a Mohs surgeon. I trained and did a fellowship in Mohs surgery, and so that is what I do. But I have colleagues like Dr. Aneja who specialize in general dermatology as well as cosmetic, and because of that, we're still offering comprehensive care, but we get to follow our passions.
What is this Mohs surgery? I know you have some specialization in that as well. Mohs, what is that?
So it's kind of the gold standard technique for removing skin cancer, and mainly the non-melanoma types, basal cell carcinoma, squamous cell carcinoma, and it's a technique that allows us to remove the skin cancer with the highest cure rate, but take out the smallest amount of tissue. So generally, if somebody were to have an excision, we would mark where we see the skin cancer. We would take a pretty good sized border of normal skin around it. But since I'm going to check the skin, that cancer while the patient waits, I can take a border of maybe 1 to 2 millimeters.
Wow.
While the patient waits, we analyze it under the microscope. If I saw that there was still a small amount at one edge, take a little bit more, check it again, and we keep going until we get it all out.
Unbelievable. So what all dermatology services do you offer?
At our group, because we have so many locations, we really do consider ourselves to be expert in skin, hair, and nails.
Oh, wow.
And so for patients who have skin cancer, we obviously have most fellowship trained surgeons like Dr. Morehead, but we have other experts in skin rashes like psoriasis, experts in acne, experts in allergy testing, experts in hair loss and hair restoration. And so we feel like we have a comprehensive team that can address all of your skin, hair, nail needs and concerns. At our Lee Road Aesthetic Center, we also do a fair number of cosmetic and aesthetic treatments that help patients who are interested in facial rejuvenation, improvement in wrinkles, fine lines, textures. We also have some newer therapeutics that are directed at body contouring and fat loss.
Wow.
So many things.
Yeah. I'm 41 years old. Should I be doing an annual skin examination?
Definitely.
I got to get in there. What's the best way? Let's say I'm skipping my primary care. I want to call you directly. What is the best way to schedule an appointment?
So if you go to our website, it's probably the easiest, advancedderm.com. It will even show you on the website if there is a same day or next day appointment in your area, and then also the phone numbers on there.
Got it. Awesome. Dr. Christine Moorhead, Dr. Savina Aneja, thank you so much, guys. That was great stuff.
Thank you.
Do yourself a favor, call them right now, and you got to get this annual screening. It's easy. They've made it less invasive, and I know the good people at Advanced are fantastic at what they do. We need to get in there. We need to get our skin checked,
I go for my skin checks all the time.
How often do you go?
More than normal people, I guess. Normal people, is that a thing? More than the most?
And no joke at all. I know that many of you are probably like me. We don't love going to the doctor. After today, I've convinced myself that I'm going to get my skin checked, because if you wait too long, it can be too late. That's the problem. Here's what we're going to do. Quick break. When we return, Justin's Choice is right ahead.